Trimester 2 to treat. So in this sequence, we're going to be looking a lot at relieving and preventing pelvic girdle pain. So pelvic girdle pain is pain anywhere at the front and the back of the pelvis. It most often comes when there's asymmetrical movement. There's more or less movement on one side compared to the other. So we're going to do a lot with the legs together. Through this whole 3-trimester program, we work on preventing this. But if you're coming to this with some pain, this is the video for you. So you're going to start with a mini loop around your leg like me and Meg, with the ball between your knees. That is going to close down every possible chance of movement at your pelvis. And then from there, you're just going to drop a little bend in your knees, shift the weight forwards, but keep your heels on the ground. And then get you to use some big elaborate shrugs through your upper body. Down to the one side, roll to the middle so your hands are on your knees. Unravel, curl up, squeeze your shoulder blades back. Other side, big elaborate shrug, bend down to the right, curl into the center, unravel, come out. And again, alternating the sides, keeping that little stretch through the back of your legs. And the last one, all the way down, into the middle, curl all the way up, straighten your legs. Now making an even deeper bend in your knees and slide your hands down to just above your kneecap. So you're going to cat stretch here. Squeeze the ball, tuck under your tailbone, bring your chin to your chest, scoot your belly underneath you. And then stick your belly out, stick your bum out, arch your back, go the opposite way. Tucking under your tailbone, scooping all the way up and in. Breathing out, going away. How's bump feeling with that one, Meg? Good. So you scoop up through bump, lifting baby to spine. And then away. So if you get pain when you're up and about, this might be away when you haven't got a mat. Just alleviate any discomfort through your back. And we're just going to do one more. Tucking chin all the way down. Think of your spine. Goes from your head down to your tail. Move in both directions. Come all the way back through your cat stretch. Straighten your legs. Unravel. Uncurl. Come all the way back up. Now you're going to bend your left knee, come up onto your tiptoe. You're going to reach your arms open. Right arm opening all the way out to the side, circle it all the way down, point to the front. Other leg bending forward, still squeezing the ball, reach the opposite arm up and over, all the way down, point forwards. And again, opposite side, still squeezing the ball, reaching up, open your chest. That's ideally going to keep your pelvis pointing forwards. And the last one, all the way. Before you drop your hands down by your sides. Bring in the lower body a little bit more. Make sure you've got a good firm squeeze of the ball. You're going to breathe out, you're going to rise up onto your tiptoes, heels leaving the ground. Breathe in, come down, heels press into ground. Just see if you can lift your toes up. Breathe out, heel lift. Breath in, heels down so you can lift your toes up. When I look at you from the side, I should see a straight line through your ear, your shoulder, your hip, and your heel. Keep that going. And then I wonder if you can give me a little lift through the lower body. So you're going to breathe out, close the elevator doors, lift up. Breathe in, lower, open the doors. Breathe out, elevator doors close, lift. Breath in, lower, come back down. So the pelvic floor is super important in this to-treat video because your pelvic floor is the primary stabilizer of your pelvic ring. So by that I mean, if you do a pelvic floor contraction, you have a more stable, more closed pelvic ring than if you don't. So every time we do this, we're going to hone in on your pelvic floor contraction. Let's make this a little bit bigger. Breathing out, rising up onto your tiptoes, bringing in your arms. Breathing in, circling your arms down, lower your pelvic floor contraction. Go again, breathe out, arms up. Breathe in, come down. So I bet your ribs are tempted to jut out when you come up. Don't let that happen. You'll know if they do because you'll fall forwards. So you are going to just go straight up. Breathe out, lift. Breathe in, lower. Breathe out, lift. In, lower. You have 4 more. How high can you get? Rise right up, squeeze the back of your legs, squeeze your bum, squeeze the ball. Last two. Last one. All the way down. Then from here we're going to take it into little mini squats, ball squeezed. Push your arms back behind you and then bring it all the way up, overhead, lift your heels. Coming down, heel squeeze, arms back behind you. Then all the way up, arms up and overhead, lift your heels. Roll through that movement. Squeezing through the ball. When do you do your pelvic floor contraction? Now, keep lifting, keep lifting, keep lifting. Release, come down, come down, come down. Elevator doors close, lift to the first floor. Is there a penthouse? Lower it down, release. All the way up, all the way down. And one last one, all the way up, all the way down. And up to stand. Now we're going to take our ball away. You're going to keep the band just below your knees, and we're going to work on walking on the spot. So what we're going to try and do is cut out any wiggle. We don't want the pelvis to drop. We're going to keep the pelvis perfectly level. Hold your pelvis in your hands and imagine it's a bucket of water. The first thing I want you to do is to tuck your bottom underneath you, spill some water out the back of the bucket. And now arch your back, tip forward, spill some water out the front of the bucket. Go again, tuck your tailbone underneath you, spill some water out the back of the bucket. Tip forwards, arch your back, water through the front. And then just do a few of those, noticing whether the upper body is joining in with a little cat-cow or whether you are just doing pelvic tilts. And then bring it somewhere between those two positions, not overarched, not too tucked, somewhere in the middle. And if you've got a mirror to help you, check your ear, your shoulder, your hip and your heel are in one straight line. Hold your pelvis in your hand and now start to lift one knee, pushing it forwards into the band, press it back down. Then the other side, pushing forwards, bring it back down. So as you switch from one side to the other, you want to hold your pelvis steady with your hands and then eventually with the tummy muscles and the pelvic floor themselves. If you feel a drop when you bend one knee, what I want you to do is think about pulling the pelvic floor close before the heel comes up. Put that harness, that security belt around the pelvis before you lift the knee. One little drop probably doesn't seem a problem, but if we do that every time we walk, things start to get a little bit sore. Now we're going to speed that up a little bit. As that heel comes down, the opposite heel is going to come up. You're going to walk it out on the spot here. I want you to press your knees slightly open into the band so you feel that resistance. Make sure every now and again that there's a straight line down the outside of your body. Push up higher, Meg. Better, nice. Use that full range. 4, 3, 2, hold it here. Right knee bent, heel lifted. Hinge through your butt. You're just going to give me some little clams here. Right knee rolling open, right knee coming in. I've got a little soft bend in the knee. Try not to hyperextend that left knee. Pelvis bone pointing forwards. Arms pushing back behind you. Give your baby a little hug with your muscles. Lift up and in. Breathe out, twist, breath in, roll. Tuck your chin like I'm putting an apple underneath there for you. Hold that apple. 4, squeeze the butt on the right. 3, 2, 1. Come up to stand, plant that heel, opposite side. Left heel all the way up, right up onto your tiptoes. Hinge forwards, arms back behind you and clam. So notice how the other side has to work quite hard too, right? So tempting to let it fall in and follow. Don't let that happen. Keep it as your anchor, pointing dead ahead. From the side, your spine should be dead straight. Your tummy is lifted. You want to feel your ribs soft with the rest of your body. Your neck is long. Just give me 4 more. 2, 1, release. Press your foot down, rise all the way back up. Okay, we're going to start to make it down onto all fours. We're going to do a couple of roll downs before we get there, relieving any tension through the lower back into a gentle stretch. Chin on your chest, you're gonna roll all the way down to the floor, sliding your hands down your thighs, keeping a little push out into that band. Reach for your toes, hang your head and your shoulders down here, breathing in, shake your head, breathing out, lifting through belly, tucking under your tailbone, unraveling, uncurling, coming all the way up. Shoulders back, neck comes long. One more, bringing your chin onto your chest, all the way down. Lift through belly, belly button to spine, hanging your head, squeeze your chin to your chest, unravel, uncurl, come all the way back up. And then on the next one, we're going to be making our way down into 4 points. So set yourself up so you're lengthways up your mat. You're going to roll all the way down, keep it coming all the way down. When you can reach your band, it's going to come with you. Interlace your thumbs or fingers into the band, slide it down, keep rolling down, and then just step into it so it's around your feet before you make it onto your hands and knees. Soften through your hands and knees, walk it out onto all fours, and then set yourself up. So hands underneath your shoulders, knees underneath your hips. Give me a big cat stretch first. Push out into the band so the bum stays on. Hang your head, lift through belly, tuck the tail. Now release the tail, release the tummy, bring it down. Shoulder blades squeeze back, chest opens, look forwards. Go again, breastbone lift, belly lift, all the way back up. And then release, bring it all the way back down. Dropping through the pelvis. Tail out, belly down, shoulder blade squeeze, breastbone looks forwards. Now neutral spine with the breastbone lifted, soft bend in your elbows, look straight down, right leg start. Breathe out from that hip, you're going to take the foot out to the side, keep your knee on the ground. Breathe in, bring it all the way in towards the left foot. Breathe out, take it all the way out off the edge of the mat. Breathe in, bring it all the way back in. You're twisting from the hip. Nothing else is changing. You're just trying to make all of those stabilizers, the ones which are going to give you that pelvic stability back, you making them all work. You're going to breathe out, press away. Breathe in, release back in. Breathe out, push, and in. Try and keep the other leg as still as can be. Focus on the breath and see if you can tie in a little bit of pelvic floor for me. Maybe thinking about that handkerchief cue here. Gather the handkerchief, pull it through the body, release it back down. Gather, release, gather, release. Go again, taking that leg all the way out and just hold it here with a little bit of tension through that glute. Rest your foot down onto the floor. From here, you're going to lift up the opposite hand and you're going to open up towards the sky. Open your chest all the way, breathing in, breathing out, coming down, bringing that foot all the way back in. Take that right foot out to the side again. Bring the left hand up and open. And so what you should feel is a line of working muscle from that right hip across your back to the left shoulder. Ping, it comes back off again. Breathe out, tighten that spring, wrap it open. Breathe in, release it back down. And again, breathe out to open. Breathe in, lower. One more time. Hold it here. I want you to bring the weight back onto your heels, bring your hands up onto your thighs, then push yourself up. We're going to go through a little Cleopatra here, keeping the pressure out in your band. Take the weight out of your chest, squeeze, elbows in at your side, palms open, fold back across your body. Taking the weight out of the upper back, you're going to go through just a 1 minute interval here. So this is a really nice one, you can even do it sitting, so if you're sitting at a desk. Just pausing when you want to call, between calls, try and get your chest open. Don't be bent over your desk all day because you can notice how your back follows. If you open up through your chest, you're going to keep the lower back strong and the bump up and in. 30 seconds more. Squeeze your shoulder blades together. Breathe in, close. Breathe out, open. Breath in, close. Last 10 seconds. Can you grow taller from the crown of your head? Pushing out into the band once more. So you feel the glutes still on in this position. It's going to be one more. Release, bring it all the way back down. Hands underneath your shoulders. And your left leg, you're going to twist from the hip, taking it open and in. Screw that hip into the socket, take it open and in. Check the rest of your body. If you've got a mirror nearby to check your frame, then that would be great, because you want to notice that your neck is in line with your upper back, which is in line with your pelvis. You don't want to have a big banana back, and you don't want to be too rounded. You should be looking straight down with your shoulders down away from your ears. As your body changes, it's going to be really hard to keep track of all of those alignment issues, to keep an eye on absolutely everything, especially when you've only got your hands and knees in contact with the mat. So do have a little look, reset whenever you need. Okay, here we go. Next one, it's going to open. From here, the opposite arm is going to open, and you're going to feel that line of muscle working from the left butt all the way up to the right shoulder. Reach to the sky, hand comes down, foot comes in. And again, pull on the band, right arm opening up all the way around into your twist. Bring it all the way back down. So you've got an open twist again, one that gives you and baby space. Feel free to breathe a little bit deeper, take a little bit more air in here, expand your ribs east to west. Last two. And one. And then again, sitting back, sliding your hands back to your knees, pushing yourself up into kneeling again. And to finish that sequence, we're going to take it into some hundreds. Some small little beats down by your sides. So high kneeling is the absolute best position to start to get used to. It's the easiest place to work on your posture. You can tuck your tailbone into the perfect position just by opening your hips. And if you bring your ribs back over your pelvis, then your neck naturally lengthens up, shoulders down by your side. It's also the absolute best position in which to change your baby's nappy. So don't do it in standing, bent over a table. Do it in kneeling with your baby on a couch or on the side of your bed. You get a free workout at the same time. And it's the best position in which to work your pelvic floor. Turn your palms, we're halfway through, perfect. Drop the shoulders, lengthen through the crown of your head. Breathe in, 2, 3, 4, 5, out, 2, 3, 4, 5. Trying to cut the bounce, don't move anywhere else. Last 10. 3, 2, 1, release, take it away. So now we're going to take the band off of our ankles, and we're going to make our way into side lying, and we're going to use the ball to work inside thigh. So whenever you change position, try and do it with your legs together. Make your way lying onto your side, and you're going to have your hips bent up at 90 degrees and the ball between the knees. You're going to hold it here. I want you to start with your arm down on top of the top hip, squeeze the ball between your knees, and then you're going to take your top arm forwards out in front of you. From here, you're going to push that hand down towards the floor as you drop the top knee down towards the mat. Breathe in, lift that hand up, lift the knee off. Breathe out, press down, breathe in, lift up. So as though you're lying in water and you're pushing your hand down through the water. We're pushing a really stiff buzzer all the way down. Breathe in, lift back up. It's going to get this emphasis on the closure through the front of your tummy. So whenever we're lying on our sides, from now on, we're going to make sure that the waist is lifted and the baby is supported. So your baby is forwards from your waist, right? So you might need to put a little cushion underneath your baby bump, but even with that, you can keep your waist up off the ground. Now we're going to work on a 10-second hold. You're going to push down through your hand and through your knee, and you can do a pelvic floor contraction for me, wherever that comes from. Elevator lifting, or the corset coming on, or a zipper running all the way underneath your pelvic floor to your belly button. Release, hand comes up, knee off the ball. Go again, breathe out, press down. Try a different cue. Maybe the handkerchief cue. gathering all four corners of the pelvic floor, lifting up and inside through the middle of the body. Or my favourite one, imagining the pelvic floor is a jellyfish. Open up. Like a jellyfish, when it swims, it pulls its gills together underneath it, right? And it lifts up through the water. So press the hand down, push the knee down, lift and gather the jellyfish, pull the jellyfish up through the water. The pelvic floor does the same action. Release. And we're going to do one more time. Come all the way down, push, maybe lifting through the middle of your body with a handkerchief, imagining it as a jellyfish, swimming upwards. Hold it here and breathe. 3, 2, 1, release, let it go. You're now going to slide your legs back behind you, so you're open through your hips and your feet are dangling off the back of your mat, and you're going to lift up onto your forearm. So you want this lovely straight line through your body, maybe with a bump in the middle, but that's okay. The rest of your body is in a nice straight line. Sink down into your shoulder. As you breathe out, you're going to squeeze the ball, you're going to lift your waist up, you're going to come into a little banana bend. The top arm is going to come up and over and touch the floor above your head. Breathe in, come all the way back down, sink into the mat. Breathe out, lift your chest, lift your waist, come all the way up and over. Breathe in, come all the way back down. And again, ball squeeze, lifting up and over. Breathing in, coming all the way down. And we're going to hold the next one. We're going to lift through our waist. The top hand is reaching out in front of us. You're going to swing that arm down by your side, and then on your out breath, you're going to take it all the way back up and overhead. So you're working on this static contraction through the front of the body. You're working on that lift through the waist. So your lats, your obliques, your shoulders, all working through that underneath side. You're just going to swing the arm. Breathe out, one arm up and over your head. Breathe in, it comes back down. That is the weight on the core contraction. As you lift up, you're going to lift your pelvic floor. As you lower it down, you're going to release your pelvic floor. 3, 2, last one. Release all the way back down. Now before you lie down, just take your ball away and place it between your feet. Keep your feet dangling off the back of your mat and lie back down on your waist. All right, so too much movement at the pelvis can stir up any pelvic pain. So instead we're going to stick with isometrics. We're going to roll open the top knee, squeezing the top heel down into the ball. And then you're going to roll all the way back down, keeping that pressure on the ball the whole time. So you squeeze into the ball, then you slowly roll open the knee. You're going to pause at the top. The tension is going to stay on the whole while, and you're going to come all the way back down. Don't release the tension, keep it on. So you're creating an environment which keeps that side of your pelvis closed while you do the movement. Rolling through your hip, releasing back down. Just focus on that ball squeeze and a breath out to open, breath in and close, breath out and open, in and close. Now on this last one, we're going to hold it up there. So you're going to open up through the knee, squeeze your heels down and together, just pause. So you get this little pincer grip through the heels. If that feels okay, maybe lifting your feet up off the floor, make that a little bit harder. The bottom comes on really hard then. And then give me some mini little pulses to the end. Wrap open that top knee and close. Wrap and close, wrap and close. 10 more pulses. Keep working on that top knee rolling open. Imagine what's happening at your pelvis. It's drawing together behind you. It's squeezing together, giving you that stable base. 5, 4, 3, 2, 1, release. Bring that all the way back down. From here, just lose the ball for a moment. You're going to push yourself up through all fours for a little hamstring stretch. So rolling onto your hands and knees, you're going to slide the one leg up in front of you, and then you're going to roll your body up into a split kneeling. From here, you're just going to step that front leg forwards. So you can get your knee as straight as possible as you hinge forwards. You're going to use this little stretch to untuck your tail. So sometimes it's quite nice to just reach behind you and lift your tail up and out. So you lift from the sit bones, lift through your bum. Feel that little tug as you lift the fascia and you pull that stretch on. So as good as your hamstrings are at helping the pelvic floor work, they're also pretty great at pulling our pelvis underneath us and unlocking the lower back. So we want to be able to get our tail out. In a tail out position, the pelvic floor pulls taut, and it's the foundation of your lower back, right? So if your tail is in neutral, your lower back's going to sit in a great position too. If you can, bring your arms back behind you and work to open the chest at the same time. And we're just going to rock here, slightly forwards and back. Easing into that stretch, trying to get it a little bit deeper. Only take it where it's comfortable. 3, 2, 1. Rise up, slide that leg back. Bring the other leg up forwards. Same thing. Sit back, straightening out that leg. Reach behind you and see if you can just lift your butt cheek out behind you. So you're lifting your sit bone up. Feel that deep fascial stretch on that line. And keep your toes down. As soon as you lift your toes up, you get a nerve stretch. We're going for a muscle stretch. So try and lift your butt, press your leg down, and just hold it here. Maybe take your arms back behind you and think about that action of untucking your tail, lifting your chest up. And you can do some small little pulses as you hold that stretch on. Nudging deeper into that stretch the whole while as it warms up into it. 3, 2, 1. Rise up, slide the leg back. We're going to take it onto the opposite side. So you need to keep your ball with you. Have I stolen your ball again? So ball goes between your knees and you're going to lie down on your side. So your legs are going to be up to 90, tailbone out behind you, feet directly underneath your knees, and you're going to have your waist lifted. So we're going to work here on that ball squeeze. Breathe out, press down. At the same time, bring your top hand pushing down like you're forcing down a really stiff button. Breathe in and open. Breathe out, press down, top knee down into bottom knee, top hand down into the mat. Breathe in and open. Breathe out again, press, 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 press. Breathe in, open. So make sure that your waist is lifted, your neck is long, and your tail is out. And then this action is going to do its own job of bringing on the core, which is made up of your pelvic floor, your diaphragm, your deep tummy, and your back. It's all working like one big muscle corset. Hold the next one. You're going to push down through the arm. You're going to squeeze the ball, hold it here. What about a little pelvic floor contraction now? Hold it here and breathe. Hold it here. Release. And again, ball squeeze. Press down through that top arm. Press down, push and close. Shoulder stays away from your ear. 3, 2, 1, and release. Breathe out, push down, squeeze the ball, press the top hand down towards the ground, push, push, push. Think about the pelvic floor lifting. Is there another level of a lift? Hold it here and breathe. 3, 2, 1, release. Let's just do one more of those. Squeezing the ball, bringing the top hand all the way down, pressing down into the floor. We've got a big imaginary buzzer there. Push down. 3, 2, 1, and release. So from here, you're going to use your top hand to help move your legs back behind you as you come up onto your bottom arm. You want your feet rested off the back of the mat and your hips pushing forwards. You're going to take the ball between your heels. Okay, so now you're going to work to lift your chest. The top knee is going to roll open and close. So you're going to squeeze into that ball, and you're not going to stop the squeeze until we finish this set. So your heels are going to drive together. And you're going to keep your top arm back. Keep your waist lifted. And keep that squeeze. So that squeeze is going to keep your pelvis closed, even though you're moving your hip. So if you normally get pain with this movement, you should notice that this reduces and gets easier and easier and easier the more you squeeze the ball. I know it doesn't make sense, but as your pelvis starts to move more, the more muscle control you have, the less it moves, the less pain you get. Ready? In 3, we're going to hold it. Give me 2. We're going to hold it here. You're going to squeeze the ball. You're going to take that top arm. You're going to reach it all the way up and over your head. Look down at the bottom arm and hold this pressure. Keep lifted through the waist. Imagine in your hand you've got your pelvic floor and it's that high up. Release, close the knee, come back down. Give me 2 more like that. You're going to open up all the way. Hand comes up and over your head. Hold it here. Release it down. And 1 last lift. You ready? Ball squeeze. Open up. Lift the pelvic floor. Hold it at the top here. Long neck. Ball squeeze for 3, 2, 1. Release. Close your knees. Slide the ball now up between your knees and push yourself over onto your hands and knees. And I want you to take this into 1 last little stretch. You're going to take a C curve through your spine. So I want you to look over your right shoulder and lift your right hip towards your right shoulder. C curve your spine. Release your tail, look forwards, take it the other way. Bring your left hip up towards your left shoulder so your spine takes on a C curve. Take it the other way, right hip to right shoulder, squeeze your waist. And again, left hip to left shoulder, squeeze your waist. Back into the center, sink your bottom back, and then with your chin on your chest, you're slowly going to roll up to sitting, restacking your vertebra, 1 at a time, unraveling, uncurling, shoulders back, head floats up towards the sky. Well done, that's your series for trimester 2. Good work, Meg.